sort of cloudy-headedness and fatigue. So you can also take them at different times throughout the day in a schedule that works with you so that you're not suffering too much from cloudy-headedness and fatigue and your pain is controlled. Pregabalin, which is Lyrica, is much better absorbed in the gut, and that's partly why the effects are much faster. So soon after you take the medication, within an hour is when you start to see peak effect. But there's less of a treatment range. So you don't have that freedom as much as you do with gabapentin to take very small doses or very high doses. It's a narrower treatment range that's approved. Both of these medications, would I say, play well with other drugs, meaning that they are processed in a way that's different than other drugs are processed, so you don't get drug interactions. Both of them are non-addictive. And if you take them with most of the dosage that you take in a day at the nighttime, they can also help you sleep. Now, I said that until very recently, these were our only two nerve-directed medications. There are a couple of other seizure medications that are also effective for nerve pain, and there are a couple of antidepressants that are also effective for nerve pain. But those were the two medications that were specifically designed for nerve pain, and that's primarily how they function. This is the most recent medication that was just FDA approved this year, actually just a number of months ago, 4 or 5 months ago. And the medication is Suzetrigine or Junoviv. And this medication does not cross into the brain. So unlike Gabapentin and Lyrica or Neurontin and Pregabalin, this medication does not cause sleepiness, drowsiness, or cloudy-headedness because it only works on the nerve endings, and the pain nerve endings. So this medication has currently only been approved for short-term pain, so post-operative pain. And I think that's just because that's the easiest population to test a new drug in. And now that it's approved, I'm confident that the company is going to start testing in other indications. And I will be communicating with them to hopefully bring this to our neurofibromatosis and schwannomatosis patients to better address their pain.